Ladies and gentlemen, please welcome ASCP CEO Eli Lilly.
And it's my privilege to introduce you to our keynote speaker today, Dr. Kizzmekia Corbett-Helaire. She is, as we all are aware, the luminary that pushed us through that pandemic, because what got into your arms is what she developed. In 2020, as the world was hit by the most incredible pandemic we've had in 100 years, as COVID-19 wreaked havoc upon the entire world and scientists scrambled to come up with some kind of a system that will cure the tide of suffering, Dr. Corbett-Helaire was in fact at the forefront of those efforts. She was leading the vaccine research for the NIH, for the Vaccine Research Center's coronavirus team of the US NIH. And more importantly, it was because of her work in coronavirus biology before this pandemic hit that prepared her for what catapulted her into the future. With her colleagues and with her work, the Center development what became the Moderna mRNA vaccine, in tandem with Eli Lilly and the therapeutic models for antibody therapies as well. She helped end the worst respiratory disease pandemic that this country has seen, as I said, in over 100 years. And as a result of that, she's here today to talk about her work. She's going to talk about her work, the innovations in science. She's going to talk about the early influencers that brought her to this particular day, and why she's standing before you as a true medical laboratory scientist. Let me please welcome Dr. Kizzmekia Corbett-Helaire.
Oh, wow. All right, well, thank you so much to Dr. Holliday. Actually, backstage, he told me to just call him Blair, but I cannot do that for the life of me. So thank you so much to Dr. Holliday for such a kind introduction. And thank you to all of you for inviting me to speak with you today at your annual meeting. It is an honor to be here to witness all of your collegiality, your motivation to make your field better on a day in and day out basis. But first, let me just start by saying this. When I was asked to give this keynote address, I thought to myself, what in the world could I possibly say to a few hundred pathologists and laboratory professionals? My keynote addresses generally come with slideshows that allow me, of course, with all of the pomp and circumstance, to go about on and on about my data that my lab members sent to me the night before. But this is a little bit different. And honestly, thankfully so. Because I get to spend this time with you to reflect on my career, both the triumphs and the failures, to an audience who probably doesn't really know who I am, and for certain will not be the peer reviewers on my next manuscript. So thank you for this opportunity to take up 10 minutes of your time to literally talk about myself and not my science. But as was said in the introduction, I was the scientific lead of a team that was responsible for the first in human COVID-19 vaccines and therapeutic antibodies. Thank you. I often get a lot of questions about my time doing that work. And quite honestly, in the 2 years in the height of the pandemic, as we were doing the work, it is all a blur. I can look back at my lab notebooks and kind of remember bits and pieces, but to be clear, we were all, like many of you, working 80+ hours a week for nearly 2 years. We were all having to battle the public's distrust of the mere science that we put our blood, sweat, and tears into. And I think the part that is shamefully oftentimes dismissed is that it was still a gosh darn pandemic. A pandemic. To put that into perspective, and maybe even to re-traumatize us all, in this country alone, at one point, there were hundreds of people dying every single hour. Around the globe, there is an estimated 8 million children that lost their caretaker. It goes without saying that we were just all living and working in the midst of that. And you know, when I started my research fellowship at the National Institutes of Health in 2014, I was just simply thrilled to work in this vaccine field that was emerging called pandemic preparedness. All that meant to me as a viral immunologist is that I was going to pick a virus, I was going to do really, really good science on that virus, I was going to publish a few fancy papers, and then I was going to take my career off and become a cushy faculty member somewhere. I never in a million years expected that there was actually going to be a pandemic. But there I was in the midst of it. And luckily, I was ready. And since we're here and we're reflecting on the totality of my career, I'd like to say that I was preparing for that moment far before 2014, even when I got my PhD. I'd been preparing since I first stepped foot in a laboratory when I was 16 years old. I just had no idea what I was preparing for at the time. You see, here's the thing. We take on these careers because we like doing what we're doing on a day in and a day out basis. It's interesting to us. For me, at the age of 16, it was interesting for me to go into the lab every single day and to try to prove things experimentally that no one had ever proven before. That's science. I was determined at that point to be a scientist. Sometimes we take on these careers because we want to help people. For me, becoming a vaccinologist was just that. Vaccines single-handedly have the greatest potential to equalize health disparities, especially in the infectious diseases. And then sometimes we embark on these careers because someone has inspired us to be a pathologist or a scientist. I was inspired by my first laboratory mentor, Dr. Albert Russell. The thing is, whatever reason you choose the career that you choose, pathology in this case, it certainly cannot be forgotten that you have purpose. No matter the drudge along the way, no matter how hard it is to climb the career ladder, no matter how hard it is when you bang your head on those glass ceilings, or even when you go unheard or unseen, it cannot be forgotten that there is purpose in your little old career. And I think for me, that was the biggest lesson of the pandemic. It's that you don't have to be the hospital CEO for that purpose to be shown. And for me, I didn't have to be Dr. Fauci, for example, for that purpose to be shown. If we take the pandemic as a whole, we really have to think about the people who had the most influence on the outcome of every single person's health and well-being during that time. It was the laboratory professionals, it was the doctors, and it was the nurses, and those were the people who were most vital and had the most vital roles during the pandemic. And it was you, and your role in making diagnostic tests, diagnosing COVID, and of course, diagnosing other diseases as well. And unfortunately, with long COVID, as we begin to battle that, your role continues. And so, I know it's odd to think about how like your job can have so much importance. I know at least for me, I had no idea how important my role was until I was thrust into this moment where my role was so needed. In fact, just to highlight just how important I was made to assume my role was, at my center, the Vaccine Research Center, coronaviruses for the 7 years that I was there didn't even have a budget. In fact, I had a side project that paid my bills. It was a flu project. We'd have meetings very often to update the entire center on our progress in our research, and those meetings were poorly attended. I call that portion of my career caring about coronaviruses, because it was just that. For me and my very small team, we cared, so we kept going. And we kept going so we could do what we set out to do. Despite the little acknowledgement, despite the rejected papers. Did you know the paper that has the vaccine technology that is in over a dozen vaccines worldwide was rejected 5 times? And we had to attach ourselves to a National Academies member and go into PNAS. Isn't that crazy? In fact, as a part of this career reflection exercise that you have so lovingly given me this time to do, I looked up the definition of preparedness, just for completeness and just like a researcher researching what it really meant. And according to our dear friends at Merriam-Webster, preparedness is the state of being prepared, like, whatever. It's like not revolutionary at all. But this is where the drama comes. The definition goes, comma, in case of war. And I know that seems pretty dramatic to me too, and that's why I had to keep rereading it and deciding whether or not I was going to talk to some pathologists about war. But I guess one could say that if you are adequately prepared for war, then you are adequately prepared for anything. Literally, that is the definition of preparedness. I didn't necessarily consider my career path to be preparedness for war, but after having lived through it, I'd say I'm inclined to agree. So you're all asking me, like, why does this even matter? Why is she talking about war? Like, whatever, we're pathologists. But this actually does apply to you and almost anyone too. I just ask for you, in the same way that I call that portion of my career caring about coronaviruses, for you to decide exactly what this portion of your career is called. Now, I'm an assistant professor at Harvard, I'm an HHMI scholar, and this portion of my career is called to tenure and beyond. My job now is to continue to do my science, publish papers, and then teach to get tenure. But beyond that, I spend some of my time inspiring others, continuing to advocate for science, educating the public on vaccine awareness, and all of that together comes as my purpose. So think about it, just for 2 seconds. What is this portion of your career called? I should actually ask the president, but I won't. When you think about it, think about all of the things that you are going to do to fulfill the overarching the purpose of what you know of your career to be. The reason why I say it does matter and that you need to bring yourself back to that analogy to war is just that. No matter what the end goal is, right? No matter what the purpose is, no matter whether you are a soldier or a scientist or a pathologist, the steps to prepare for war are all overarchingly the same. You first start with the basics. So you get the skill set and the basis of any battle that you could ever be in, or in this case, anything in your career. And these are the little things that at the end of the day, they will be the backdrop of your CV, of course, but most importantly, you'll be able to pull those things out of your pocket so that you can sneak them in at any stage of your career. You know, the reason why they call this basic training is because you get these basics that are things that at any time you can build upon them. You can leave here from basic training and really ultimately do anything. You can hone one skill or another. You can go off and get another degree, but like, who wants to really do that? You can take what you learn at your boot camp stage and always use that because it is yours to use and to know. And then next in war, what people do is they assemble their allies. And so I was one time quoted by saying, "Who would want to save the world alone?" Because like saving the world, so to speak, isn't that such a burden? I did that because I wanted to make sure that I acknowledge my team and my co-inventors and my collaborators and even the companies, quite frankly. And the same applies here in that who would want to go about their career or fulfilling all of the purposes of the missions of the ASCP, as the president said, alone? You need your allies. These are your mentors, your colleagues, your classmates, and your collaborators. This is the network that you build during this time that will be your army. This is your army that you're going to take to war with you. The important thing to note, especially in science, using that as the analogy, is that sometimes those other people in your army, they have skills that you may not. The other important thing is that they pick you up when you get shot down. And your allies' real purpose is to make sure that you are never left in the war zone alone. And now, the last piece of getting ready for war is the fun part. You get to arm yourself. So this is when you find your secret weapon. This is when you find the test that you can best do in your laboratory. Whatever it is your secret weapon. This is the thing that you have that is yours to behold. This is the thing that ultimately becomes what people recognize you for. And it's not really about being a scientist or a pathologist, quite frankly. There's an undertone to your secret weapon that is really just about your being. This is the part of you that you get to take with you once people recognize that you are the scientist or the pathologist. And it's what you take to every single clinic or lab or conference or workplace. For me, sure, I have vaccines. I have one in clinical trial right now, actually. But really, I can take with me this being of this girl from the South who started working in a lab when she was 16 years old. And those pieces that you bring with you that are unparalleled to anything that anyone else has to offer are all of the things about remembering from where you came, everything about your training, everything that is what reminds you about why you are continuing in your purpose. Why did you even decide to be a pathologist to begin? And then lastly, for war, you fight. And that's it. That's literally the answer to the question when people ask me, how was it working on a vaccine during the pandemic? I still have no idea, by the way. I can barely remember. I probably won't write a book because I don't even know. All I know is this, is that I would have never wished a pandemic on anyone, especially not a global pandemic on this world. But I spent 15 years after being inspired by that one scientist when I was 16 years old, taking all of the things that came, the allies, the mentors, the colleagues, and et cetera, preparing for a pandemic. And then when the time came, my whole team actually, was successful. So during that exercise, whatever it is that you termed this portion of your career, whatever it is, remember that purpose. And even if it's not really clear, like when the war may be or what you're fighting for, preparedness most certainly will get you to the point where you're ready. And trust me, with all that's happening in healthcare, with all of these new ailments coming on board, new vaccine technologies, whatever it may be, being a pathologist, eventually you will become to a battlefield where you will have to fight. Thank you.
Ladies and gentlemen, please welcome to the stage Dr. Gary Prokop. Joining Dr. Prokop is Dr. Hannah Wong.
Thanks so much. That if your mission was to inspire us, you did it.
Okay, good.
So thank you, thank you. You're passing it on to the next generation. So thank you, Dr. Corbett-Helaire, for being here. I also want to say I noticed there's a hyphenation to the name, so I think there's a congratulations to go along with that. So congratulations on the recent nuptials. So thanks for being here. Thanks for those inspiring words. They truly were. And thanks for all the work that you did to really help save the nation. Part of the team that saved the nation. That's a heck of a thing to say. So, you know, COVID-19, we all lived through it. It was a life-altering experience for everyone. And it was a great opportunity. I happened to be on one of the lead committees at ASCP at that time, and just could not be more proud of this group. They really stepped up in advocating, educating, really everyone, from government to the public to even our own colleagues. You know, I remember taking phone calls from anesthesiologists talking about viral transmission and can we actually intubate or not. And so it was really, it really is an organization to be proud of. And so we're so excited to have you here and to make that connection after this time. So thank you.
Thank you.
One of the challenges that we had early on was, and this was really challenging for laboratorians, what we work on every day is, you know, we do some of the most sophisticated testing on, you know, the nastiest virus around, right? From, you know, every day it's hepatitis C virus, highly contagious, HIV virus. We do these tests routinely. And then when a pandemic came, we were shackled. We were told that you can't test for that virus. And it's the exact same technology that we utilize every day. So, you know, again, and it was ASCP and other organizations really had to band together and petition the FDA to allow us to do the tests that we do every day. And I appreciate that they did. They let us do that. So, so that was great, and then we could all get in the game of actually beginning diagnosis, you know, because William Osler, father of American medicine, you know, one of the things he said that I always say when I'm talking, often to a group of not pathologists, other clinicians, there are 3 phases of treatment. Diagnosis, diagnosis, diagnosis. So, you know, first of all, we've got to know what that patient has in order to know if it's the right vaccine or a different vaccine, et cetera. So you've got a group here that's on the same team as you, and they're helping to make those tests, employ those tests, so we can, you know, point people in the right direction so they can get the vaccine that you helped develop. So we are on the same team. One of the things I really love that you said is, you know, while we're quoting people, right, is Louis Pasteur said, "Chance favors the prepared mind." And so I loved your preparedness talk. So we were in a situation, it was a little bit frustrating because the United States, of course, and you know, you probably know better than me, but the United States has been waiting for the next flu pandemic since 1918. And so we got it, it just wasn't the flu, right? It was another respiratory virus. So what are your thoughts in the vein of preparedness that you think if we were to do this all over again, how could we do it with no fumbles of the ball?
Well, first of all, I think that when you are in a pandemic, you certainly will fumble the ball a couple of times. The thing that you want, though, is to be able to pick up the ball and keep running. And I don't even think we did that so great. Especially when you're talking about diagnostics, right? And I think one of the reasons why our vaccine efforts were so successful to get through to regulators really quickly, get into clinical trial really quickly, aside from the science that it was built upon, was we had primed regulators for this moment. Mm-hmm. We'd primed them in a way that said, okay, these would be the clinical trial sites even. You know, these would be most likely the types of vaccines that might go into a pandemic. Actually, they were primed even to know that most likely in a pandemic, mRNA would be the type of vaccine candidate just because of the nature of mRNA vaccines. So my advice there would be, specifically in how you were talking about it, my advice there would be to, in a collaborative way, of course you can't do it alone, right? In a collaborative way, maybe even bringing in companies, which is what we had to do, and et cetera, is priming regulators for the moment that might be a pandemic. And also reminding them, this is what the Vaccine Research Center did, reminding them that for the last few outbreaks, you stood on top of recognizing that outbreak and getting the test out, or in our case, getting the vaccine out. Right. But we certainly, you say that the United States spent, since 1918, getting ready for the next flu, but quite frankly, had it been an influenza virus, I don't think we would have been any more prepared than we were. Right. And part of the reason why is because we aren't great at, as we think about, the war analogy even, we aren't great about running drills. Right. And so we say we're preparing for the next 1918 flu, but the flu comes around literally every September. And we aren't running the drill of making sure that the ER isn't overcrowded, or making sure that we run vaccine awareness campaigns so people can continue to get their seasonal flu shots. All of these things we have to do. And so banding together and probably putting some resources towards running drills is so important.
Absolutely. Thinking about your comment about priming, the FDA and regulators about your vaccine, and thinking about, what can we do as laboratorians to help prepare for the next pandemic and prepare regulators maybe for similar events. I'm curious, you mentioned, that you primed regulators potentially for the possibility of an mRNA vaccine, and this would be the most likely candidate. Can you tell us a little bit about why, and why did you choose an mRNA?
I should say not I primed, because it was far beyond my pay grade to prime regulators or anything. But, one of the reasons why it became over time very clear that mRNA was going to likely be the technology that would help us make a vaccine for a pandemic under this pandemic preparedness field was that mRNA is fairly easy to manufacture. The manufacturability is really reliable. And actually, when I saw someone at Moderna speak about their science, like way back when I started my postdoc, before we started the collaboration, I stood up in that meeting and asked, when does this ever fail? Because the data was absolutely so beautiful, especially towards viruses that need really, really, really good antibody responses in order to be protected against. So it became very clear very quickly that if you wanted to move fast to get a vaccine out, you wouldn't be able to go into the lab and make clinical grade protein, right? While Novavax's vaccine is great, it contains my mutation, so I absolutely think it's great. It took them a long time to get the manufacturing right because it's protein-based. And so these typical and classical vaccines take longer to manufacture, even enough to even start a clinical trial. And so mRNA was certainly the way that we felt would be best shall a pandemic erupt, and it did.
So I've got a couple questions about mRNA, and I want to preface this by saying, talk to me like I'm a 5-year-old or a golden
God.
retriever, because you're probably up here, and these are going to probably seem like simple questions. But so, when I think back to what I know about messenger RNA, it's short-lived, it's very labile. The mRNA that's in our body that we make in the transcription translation process, gets chewed up relatively quickly. If external RNAs come in, we have body defenses to take care of them. So how do we make a vaccine actually work? How do you protect that RNA and, trick the cell into turning it into the protein you want it to be?
Okay, so this is why Dr. Wiseman and Carrico got the Nobel Prize. They spent...
Remember, golden retriever.
they spent about 10, 15 years working on literally how to make, more so how to cap mRNA so that you could hide it from the immune system. All of these capping technologies, including Moderna's, are proprietary, but you add some nucleotides to the front, and beautifully enough, long enough for the protein that is being expressed in your body, the body will ignore that mRNA. Eventually, it does get degraded, but after the protein is expressed.
Got it. Nice. We had a very interesting, talk yesterday, and it was a breast cancer topic. And one of the things that was discussed was, linking chemotherapy to an antibody and then infusing the antibody. And I remember, us talking 10, 15 years ago about infusing antibodies for a variety of reasons, and people saying it can't be done. You'll cause serum sickness, et cetera. So, it can't be done, or we don't know how to do it yet.
Yeah.
Is probably better. So thanks for that.
Yeah, and bringing up cancer, there are 1 million mRNA companies now, and they all have their own little niche. But Moderna's niche and why they were so popular was all around cancer therapeutics. I think actually that's probably still the sect of Moderna that is has the most scientists, and they're really, really into delivering cancer drugs via mRNA.
So we were talking a little bit backstage about your current work.
Oh, gosh.
And how it's maybe departed a little bit from mRNA, and you're working now on maybe nanoparticles and multivalent vaccines. Can you tell us a little bit about sort of what you're working on now, and is it possible to develop a vaccine that will keep us ahead of coronavirus evolution rather than, trying to play catch up with the next new variant?
Yeah, so, well, first, my flu vaccine that I told you paid the bills, is that idea that you can protect against something prior to your body or it even appearing in the world. And so we call this field universal flu, but in this case, universal coronavirus vaccines. And so I do certainly think that it's possible, but remembering that just like your family tree, viral family trees are huge. And so while it might be easy to protect against a sister, it's harder to protect against a cousin, and certainly a third cousin. So we do have a long way to go, actually. And people are looking for that data from that clinical trial to come out, and I'm excited too, but hopefully haven't primed people to think that we will have a universal coronavirus or a flu vaccine tomorrow, because I don't think that's the case. But it's possible, for sure. And especially, you said that I pivoted from mRNA, mostly because I have to get tenure. So if I just did mRNA for the rest of my life, everyone would say I'm not doing anything novel.
You're doing okay. I would tell you, you're doing all right.
I still really believe strongly that messenger RNA is going to be the wave of the immediate medical technology future. But nanoparticles have a way of delivering more than one thing at once. If you're thinking about cancer, you could deliver the antibody, the chemotherapy drug, you can wrap it in a ball. You can do all of these really fancy things. I call the nanoparticles that we work with, I call them Coco Chanel nanoparticles, because they're designer. You can really design them to do whatever, and they're also really expensive, so.
No, that's very interesting. I know, at Cleveland Clinic, one of the, and actually she was, one of our research technologist's husband. Unfortunately, he passed away, but they're working on a breast cancer vaccine that is based on mammoglobin. And essentially, after a woman has passed childbearing ages, she shouldn't be making mammoglobin anymore, but breast cancer is making mammoglobin. And basically the idea is if you could vaccinate against that, then you could stop nascent tumors that are just forming, et cetera. So maybe it'll be a messenger RNA approach.
Yeah,
something like that could be feasible, you think?
I think. Well, I get a lot of calls from companies that pop up in Silicon Valley to be on boards and all of this for mRNA, and people have the wildest ideas. I mean, hair loss, you name it, there's an idea around it regarding messenger RNA technology. So breast cancer is low bar even, I think.
Very good.
So, interestingly, mRNA technology, it seems like has just sort of started. What do you think is in the future for mRNA technology, and what can we dream about?
I think for me, what's most dreamy, or there are two things. Combinations. So right now, particularly if you're over 60, a couple weeks ago when you got your flu shot, you got your COVID shot, and then they also sold you the RSV shot too, probably if you went to the right pharmacist. So that's 3 things that you had to get. With mRNA, you could just have the mRNA and then transcribe all of those proteins yourself. So combination mRNAs are certainly the wave of the future, I think, immediately. And then right now you have to give it intramuscularly, but I think once you can co-transcribe some transporter proteins and send it to the right types of cells, you can be able to put a patch on your arm or whatever have you, and really make mRNA work, I think, with a lot more consciousness around vaccine inquisitiveness and people who are hesitant of needles and et cetera.
So a story that will lead to a question. So
Okay.
I'm interested in both history and, of course, medicine. So history of medicine's
I might not get the history right, so.
No, it's coming. You wait. I stumbled onto this interesting book called Revolutionary Medicine, and it talks about all of the, basically different diseases that, founding fathers, et cetera, had to face. And the very first chapter was all on George Washington, and it was very interesting because George Washington actually launched the first public health mass vaccination in the United States. And it was against smallpox, because smallpox was prevalent, and people had been experimenting with variolization and early vaccination, and he decided to vaccinate all the troops. And believe it or not, it was controversial. So getting to the controversies around vaccines, I'm sure you have been asked more times than you ever want to remember. How do you deal with the questions of, is it safe? Will my daughter be sterile after taking this? How can we prove it? It came out too fast. And these are your apostles. I mean, what we hear from you, we're going to be asked by our family members, by people in our churches and synagogues, and so it's really helpful. It will be helpful to hear how you approach some of those questions, since this is yours.
I have to now after I said I didn't know any history, now I have to now I do have to say a little bit of something about history, because I know a little bit about smallpox vaccine.
Okay.
And that it was actually an enslaved man who brought over the idea behind smallpox vaccine.
Okay, right.
He was an enslaved man in Boston. His name was Onesimus. I always have to say that because it's important not that his knowledge be forgotten. But regarding how to talk to people that are inquisitive, I like to say, around vaccines and have these questions, whether it be, is it safe? Did it come out too quickly? The first thing that we want to do, because we are these bubbles of knowledge all the time, is we just want to say the real, right? No, it's safe. And do you know Kizzy? She was working on that thing for 7 years. So no, it did not come out too fast. You want to say that, but the truth is, for the most part, in many patient populations, these people just want to be heard, there is oftentimes a story behind the inquisitiveness. And I find that part of being effective regarding regurgitating our facts that we know is simply listening to what they have to say as to why they are inquisitive. And so it went like viral when I was on MSNBC, and there was a man who stood up and said he was terribly hesitant, maybe not the nicest, but afterwards the camera caught me going over to him and talking to him, and he had this story about the doctor's office, and it was like such a simple story, but it was one that even though the doctor wasn't trying to give him a vaccine, he carries that with him, and that's why he's hesitant of all things that come from medicine. And I think that when you listen, you have a lot more impact on of them listening to you. So that's really important. The one thing that we can't do, though, on a very wide scale, is have these one-on-one conversations. And so there is a level of making sure we catch people, and I'm talking about younger people, at the right time. There's going to be a generation of inquisitive, so-called minds that is lost if we allow the misinformation or what even could be considered like the political cloud around vaccines to take over. And so, not saying that you ignore an entire other generation, but there are like my nieces and them who are on TikToks and Instagrams and all of these things all day, and probably not watching my MSNBC special, by the way. And we have to really focus in on that group, not only because it's important that they be vaccinated, but it's important that they are also taking their grandparents to be vaccinated. It is also important that they are going to be teaching and repeating what we're saying to their peers in ways that are going to reach the masses. After you talk to someone of that age group, they're on Instagram telling all their friends about it. So I think that that's really going to be the way that we go about it. And I think also to be frank, I had to do a lot of research about ASCP before I came here. You'd be happy to know that I did do my research, but one thing that I found that was was amazing to me, and thank you for that, is that you all ran some really, almost better than the government's vaccine campaigns, and so I think
we agree.
Yeah, I think that if even here, right, in this group, but then outside of this group, even with colleagues beyond, right, we can all come together and do that same thing on a continuous basis, making sure that we really hone in on the generation that doesn't like to listen.
You make such an important point, which is each of us has that opportunity as leaders in our profession, in the laboratory, to go out and have an influence in our communities, especially with people that look like us or have the same background or experience. I think that's really powerful. It's something that, I talk with our lab team is, we talk about, this week, COVID rates are increasing, and why is that? Or, and there's this new data out on this RSV vaccine, and we are sort of the messengers, right? That's a responsibility that we have to take on.
Yeah, it's sometimes a heavy responsibility, but you're right. And I think the momentum that the pandemic gave us as laboratory professionals, doctors, et cetera, is that people actually are more open to having conversations. I was actually, even though it was daunting to hear about the vaccine hesitancy, I was happy that people were questioning something that was going into their body, because now it opens up a ton of other questions that we get to answer that we've been wanting to answer for so long, like why you need to have breast cancer screenings or, all of these other things.
Right. Well, we are about at the end of our hour. I think we could keep you all
no.
day, but again, thanks. Truly inspiring, and it was a lot of fun.
Yeah.
So we just, really cannot thank you enough. We also want to take a minute, thank our sponsor. This is sponsored by Hologic. So really appreciate that. We have a few reminders for our audience. Join us for lunch in the exhibit hall. That'll be going on right after this. And there's a satellite symposium by Astellas at 12:30. Please think about joining that. And then don't forget about the evening reception in the Cove, 5:30 to 6:30. And tomorrow, a breakfast at Seagen's Patient Symposium. So we will see you at all of these. And again, thank you. This was
Thank you. It
super.
was fun.
We appreciate it.